Hi guys, welcome back to my channel. As you guys can see, I am joined with Tommy and Roxy. You can literally see their personalities right now. She's so sweet and calm. He's crazy. I did just get off of work and I thought, why not make a video about what I do? I'm gonna be talking about like the different tasks. Tommy, about the different tasks that I have at work. And I am gonna be touching on stop. And I am going to be touching on how I personally deal with euthanasias. If you guys don't know what that is when we unfortunately have to put doggies down or cats. So I did there's a lot to talk about. I did kind of make a little list so I can make sure I don't forget anything. So I'm going to start with like the different tasks that we have at work. So first one's reception. Basic, I answer phones. A lot of the time people will call just to make appointments. They'll be like, oh, I have to pick up some food, or oh, can I get a refill for my dog's medicine? Yeah, so I just put it all on the computer. And when I put, Tommy, you need to stop. And when I put it on the computer for medications, it does print out a label. So we have to make sure that everything's spelled correctly, the dosaging is right. And then it prints out whoever gets that label, and it can be any one of us. We read the directions, make sure it's correct again for a second time, and then we sign it. Make sure it's the right medication, of course. So that's kind of reception. A lot of the times people do call and they're like, oh, my dog did this, or oh, my dog's doing this. Should I bring him in or not? A lot of the times it is pretty simple for us reception people to just be like, oh, just watch out for this, for that. But if it's something a little bit more serious, we definitely go talk to the doctor, and she lets us know what, to tell the client. So that's basically what reception is. Next thing that we have is room assistance. Room assisting is my favorite. Basically, we're like the nurse, like the medical assistant, which I don't like to say medical assistant because we do so much more than, just the blood pressure. And I'm not trying to knock down anyone who's a medical assistant, but so basically when we're in rooms, we, ask the owner what's going on with your dog. We ask them what food they're on, any medications, if they're on heartworm or flea control, if they're dogs. If they're cats, we ask them if they're on any flea control. We make sure all their vaccines are up to date. If they're not, if they have like some that are past due, we ask if they want to booster that then. What else do we ask? For the history, like I said, we, ask what's going on. Then we have to ask any sneezing, coughing, vomiting, diarrhea. Are they eating and drinking okay? And are bowel movements and urination normal? And they'll be like, yeah or no. And then that's basically what we're typing up. What I always say when I'm done is I'll be like, okay, I'll let Dr. Battles know or Dr. Shite know, and then we'll be right in. And they're like, okay. So what our job in room assistance is, we have to go tell the doctor everything basically that the client said. So once we do that, the doctor goes in, and our job is to, sometimes the dogs and cats are calm enough for the doctor just to be holding, and us room assistants, we have to type everything that the doctor and the client are saying. So we have to be like, our typing skills have to be like on point. If the dog or the cat is kind of crazy and the doctor needs help holding, unfortunately we have to hold the cat or the dog for the doctor and remember what they're saying so we can write it in or type it in the chart later. So we have to definitely have a good memory as well. Let's see, that's basically room assisting. It's kind of complicated if there's, if it's just a super easy, healthy exam, vaccines, after that, the room is done, next room's up. But if it's something more complicated, we usually get a lot of, they're limping, they're vomiting or diarrhea, or they have skin issues. So that's kind of where, like if they're limping, the doctor's gonna say, okay, well, let's do RADS, let's do blood work. So it's our job to, type that in the computer, make sure that it's on their invoice, and then we take the dog or cat to the back and be like, can someone help me with RADS? Can someone help me with blood work? So that's kind of what everyone else kind of comes in. So we are actually the ones that do take the radiographs, and we are the ones that do draw the blood. We do run the blood work there if it's being done in-house. So we have to know our tubes. A lot of people, like, if we say, oh, we need blood work, they'll be like, what do you need? We need a GHP CBC lights. So we have to know what tubes to get for that. And that's in-house. If it's going to our labs, it'll be a SuperChem CBC T4. Sometimes UA, sometimes not, just depends. So that's another thing we have to know, is we have to know what tubes we're going to be needing and how much blood to actually pull and how much blood actually goes into each tube. There's a lot. And then I think that's basically it for rooms. And then we also get we're kind of like the pharmacy technicians, I think, because we're not actual pharmacists. We can't prescribe, but like I said earlier, we get the medications ready, we count the pills, everything like that. Next thing are dentals. Dentals, they're all right for me. I don't necessarily love them, but I don't necessarily hate them. I'm kind of in between. There is so much that goes with dentals, you guys. I never realized it until I got trained in doing it. So basically, cat or dog comes in, they do have to be fully like under anesthesia. They can't be awake. It is the client's or the owner's option as to if they want dental radiographs. So just like when we go to the dentist, they take x-rays of our teeth. So we give that owner the option. A lot of the times the teeth do look healthy, you know, when we're just looking at them. But when we x-ray them, we could see if they're abscessing at the root or if there's any bone loss or things like that. So that's always what we recommend. So if there is radiographs, we do need to take them, us assistants and the techs. If you guys don't know the difference, an assistant is just, you know, someone who basically went to school. The techs went to school as well, but they did pass their RVT or their registered test. So it's kind of like a nurse and then an RN, if you want to put it that way. So where was I? Dental radiographs. So we have to know how many teeth the dog have, how many teeth the cat have. We have to know how many teeth the dogs and cats have up top, how many teeth the dog and cats have in the bottom. We need to know the number of roots, what teeth have single roots, what teeth have double roots, things like that. So basically we take the x-rays, just like a big old machine like how we have. Tommy, stop it. So I like to have them laying on their stomach. So they're just basically like this. And I like to start from the back right, just shoot all the way across, and then I will start then I'll put them on their side, and then the beam will be this way, and I'll shoot those ones. When I have to get the bottom ones, I will flip them on their back, so it makes it easier for the beam to just be hitting right here, if that makes sense. There's definitely different techniques. You kind of have to see what works best for you. It looks super easy to take x-rays, but you really need to know how that beam is going to hit and where the roots end. So you have to definitely know all of that. I'm doing okay on them right now. I'm definitely not a professional, but I definitely don't know what I'm doing. But they're interesting to do. So once we're done with the radiographs, if the owner wanted to do that, we will probe the teeth. So just like I said, when we go to the dentist, we have that little kind of stick needle-y thing, and we probe the teeth. So we have to look for pockets. We have to know the normal pocketing for a dog and a cat. If it's anything abnormal, we do chart it on their little chart. We have to know bifurcation 1s, 2s, 3s for dogs, FORLs for cats. We need to know if there's gingivitis, if there's staining, if there's wearing, if there's pulp exposure, if there's tip fractures, slab fractures. There's definitely a lot of things that we need to know when it comes to dentistry. Once we're done, doing all of our findings, we let the doctor know. The doctor will look at the radiographs. She'll look at the chart. She'll even look at the mouth herself and be like, okay, it looks good, wake them up. And then we do polish the teeth. If she says everything's good, wake them up. If she sees something in the x-ray, like an abscess or bone loss, or that tooth is like barely hanging on, she'll be like, extract that one, extract that one. So then the RVTs, only the technicians extract. Us assistants can't. So they'll extract them, and then we do polish them and fluoride treatment, and then they wake up. So that's basically it for dentals. Okay, so next thing comes is surgery prep. So what that is basically we have to know if it's a spay, neuter, cystotomy, foreign body, splenectomy. We have to know for each individual thing how far we need to shave. So once we do that, we take them to the actual surgery room. We hook them up with the heart monitors, the SpO2, which checks oxygen. We put, what else do we do? The blood pressure cuff, we just hook them all up. So we do have to be knowing how, like the normal vitals while they're under for a dog, for a cat, for a small dog, for a big dog. And well, cats are basically all the same size, but we do need to know those normal values for each thing. If something, becomes concerning, we do have to let the doctor know. So that's kind of surgery prep and surgery monitor. Let me fix my hair a little bit. I look a little crazy, huh? So now I'm going to talk about how I deal with the euthanasia rooms. It's hard. Every time I see that a euthanasia room is up, I'm just like, man, someone has to take it, we have to get rooms going, and I'm just like, it doesn't bother me to take them, but there have been a few times where that day I was in rooms and I took like 3. So once it gets to something like that, I'm kind of just like, I don't want to. Can someone else take it? We rarely get any euthanasias, though. We have really good client base and we're at a good location, so we don't see them every single day, but it's like when we do, there's probably like 2 a day or something like that. But so anyways, I go into the room. I say, it's just hard. It's hard having to talk to the owners because it's not a happy, visit. And so I go in and I'm just like, hi, you guys. And they're like, hi. I try to make my voice sound very sweet and, caring for them. And I always go to the dog or the cat and I pet them and I say their name's Bella. I'll be like, hi, Bella, you're so sweet. I just try to love them for a little bit. And then I will, I ask the owners, because we do have a private or a group cremation. So I let them choose. Once they choose, so how we do it in our office is we do, ask the owners if we could take their select method of paying up front. That way when, everything's done with their pet, the owner can just leave. Like, they don't have to worry about waiting in line, waiting in front of everyone else, crying, still having to pay. So that's how we do it there. So then, I come back with the owner's receipt and whatnot, their card, and, I let them know. I'm like, do you need a little bit more time? Or are you guys okay? Do you want me to let the doctor know? And they usually always say, you can let the doctor know we're ready. So then I have to go to the doctor, and I tell them that they're ready. So me and the doctor, we go in. What it is it's basically an injection of an overdose injection of anesthetic. And that's what the doctor does tell the owner too. It works very quickly. The doctor, I kind of just hold off. Oh, perfect example. Perfect. I'm sorry I have to use you for this. But so say the doctor is going to inject it into, the arm, the front arm. What I have to do is I have to hold off the vein so it can be a little bit more prominent for them. And that's where they inject. And it does, like I said, it does go, they do fall asleep pretty quickly. Then the doctor will, use her stethoscope, make sure that there's not a heartbeat anymore. And she'll tell the owners, she's gone. She's sleeping now. And that's usually when the owners kind of even cry a little bit more. I don't cry in every euthanasia room. It is sad. I feel like it hits me more, and I do get teary-eyed when the owners are like actually talking to the dog, when they're like, I'm sorry I'm using this as an example, Roxy, when the owners are actually like, oh, you were such a good dog, you were the best dog, you made me so happy. Like, good boy, good girl. And I'm just like, like, don't say anything, owners, please. Like, I'm about to cry myself. You know, I just start to think of my little guys, and that's kind of what makes me sad when I do hear the owners kind of talking. But I mean, it's part of the job, unfortunately. And we do, you know, it's easier said than done, or yeah, but when we do have to euthanize them, it's not for, oh, I don't want this dog anymore, euthanize them, or oh, I can't keep this dog, can you euthanize them? It's never anything like that. It's when these dogs are like about to literally pass away, like they're in heart failure, like kidney and livers are like shutting down, like they are, like no medicine, no surgery is gonna save them, and sadly they're suffering. So that's kind of when, so you know, I try to think about it that way. You know, they're gonna be happy elsewhere, they're not gonna be suffering, they're gonna be sleeping peacefully. But yep, that's basically my life every day. Like I said, you know, besides that part, I really do enjoy my job. I love my job. And if you're considering being a vet tech, just know that it's a very rewarding job. If, like I said, I love going to work every day. I love helping dogs. I love seeing dogs. I love touching, petting dogs. It's great. I wouldn't change my job for the world. Okay, so that about wraps up this video. If you guys, come here, Tommy. Come here. If you guys, you know, want to see any more videos like this, unfortunately, I can't like record at work. I would love to show you guys, but I can't. So if you guys would like to see a little bit more videos about, you know, my vet tech life, then let me know in the comments down below. Oh, Tommy, you're so crazy. All right, so that's gonna be it for this video. I will see you guys next time. Bye bye.